My name is Ashley Cobb. I am an LPN to BSN student at Indiana State University. This is Health Education Project number 5 for Community Health Nursing, and the focus will be on obesity prevention. Upon completion of this presentation, the viewer will be able to explain overweight and obesity as well as the fundamental causes, state sources of obesity-related illness and death, identify ways to reduce risk for obesity-related illness and death, list the dangers of obesity and how it affects public health, discuss public health initiatives related to obesity prevention. Please stop here and take the pretest to assess your knowledge about obesity prevention. The pretest can be accessed by clicking the link at the beginning of this YouTube video. Obesity and overweight are defined as abnormal or excessive fat accumulation that presents a health risk. A body mass index, or BMI, over 25 is considered overweight, and over 30 is considered obese. There are also 3 classes of obesity depending on how high your BMI is. The fundamental cause of obesity and overweight is an energy imbalance between calories consumed and calories expended. Globally, there's been an increase in intake of high-calorie foods that are also high in fat and sugar, a decrease in physical activity due to sedentary jobs, changes in mode of transportation, and increased urbanization. The changes in dietary and physical activity patterns are usually the result of environmental and societal changes related to development and lack of supportive policies in sectors such as health, agriculture, transport, urban planning, environment, food processing, distribution, marketing, and education. There are several medical complications of obesity which increase as your BMI increases. A raised BMI is a major risk factor for non-communicable diseases such as cardiovascular disease and stroke, which were the leading cause of death in 2012, diabetes, musculoskeletal disorders such as osteoarthritis, which is a highly disabling degenerative disease of the joints, and some cancers such as endometrial, breast, ovarian, prostate, liver, gallbladder, kidney, and colon cancers. How does obesity affect public health? Obesity has reached epidemic proportions globally, with at least 2.8 million people dying each year as a result of being overweight or obese. In the United States alone, obesity costs the healthcare system $147 billion a year. In 2016, more than 1.9 billion adults were overweight, and of those, 650 million were obese. In 2016, 39% of adults over the age of 18 were overweight in the United States, and overall globally, 13% of the world's adult population was obese in 2016, which has nearly tripled since 1975. In 1975, only 1% of children and adolescents between the ages of 5 and 19 were obese, and by 2016, 6% of girls and 8% of boys were obese, accounting for 124 million children and adolescents. You can see on the graphic here from 1990 to 2010 in obesity trends between 10 to 14% overall in the United States, up to between 20 and 30% in 2010. The pandemic has worsened U.S. obesity, the U.S. obesity epidemic. In 2020, 16 states had adult obesity rates over 35%, which was up from 12% in 2019 prior to the pandemic. This is because the coronavirus pandemic changed eating habits, worsened levels of food insecurity, created obstacles to physical activity, and heightened stress. Interestingly enough, the average adult in the United States reported gaining 29 pounds during the pandemic. How do we reduce risk for obesity-related illness and death? Overweight and obesity, as well as their related non-communicable diseases, are largely preventable. Supportive environments and communities are fundamental in shaping people's choices by making the choices of healthier foods and regular physical activity, which is the easiest way to prevent overweight and obesity. At the individual level, people can limit energy intake from total fats and sugars, increase consumption of fruit and vegetables, and engage in regular physical activity. The food industry can play a significant role in promoting healthy diets by reducing the fat, sugar, and salt content in processed foods, ensuring that healthy and nutritious choices are available and affordable to all consumers, by restricting marketing of foods high in sugar, salt, and fat, especially those aimed at children and teenagers, and ensuring the availability of healthy food choices and supporting regular physical activity practice in the workplace, and similarly for schools and for children. Both the CDC and the World Health Organization have several public health initiatives related to obesity prevention. The Division of Nutrition, Physical Activity, and Obesity, part of the CDC, aims to improve the overall health and well-being of all people with a focus on promoting health equity among groups experiencing more risk factors for chronic diseases. They use evidence-based strategies to improve nutrition and physical activity across the lifespan, starting with infants and starting healthy all the way through maintaining health and nutrition and physical activity for adults. The World Health Organization has a strategy on diet, physical activity, and health, which was adopted in 2004 and recognized again in 2011. They have the 2030 Agenda for Sustainable Development, which recognizes a major challenge for sustained development. As part of the agenda, heads of state and government committed to develop ambitious national responses by 2030 to reduce 1/3 premature mortality through prevention and treatment, obesity included. They have the Global Action Plan on Physical Activity 2018 through 2030, More Active People for a Healthier World, which provides effective and feasible policy actions to increase physical activity globally. And then they welcome the report of the Commission on Ending Childhood Obesity in 2016 and its 6 recommendations to addressing childhood obesity. We will stop here now that we have gone through the contents of the presentation to assess your knowledge about obesity prevention. A link to the post test can be accessed by clicking the link at the beginning of the YouTube video. As discussed previously, the World Health Organization and the Centers for Disease Control and Prevention have several public health initiatives related to obesity prevention. Not only that, but they have multiple resources available regarding obesity prevention on their websites. There are links provided here on this slide, as well as a flyer with links to resources is available in the link at the beginning of this video, which is entitled Obesity Prevention. It goes over the things that we've already talked about in this presentation, as well as available additional resources for continued research on the topic of obesity prevention and how it relates to public health.